In numerous countries around the world, migrant workers have faced pandemic risks, often shaped by citizenship status, government regulations, and market conditions. Let's look at a case study of the COVID-19 pandemic in Singapore. Despite years of preparation since the SARS outbreak, Singapore overlooked one key factor in their COVID-19 prevention plan: migrant workers. Sociologist Zulfikar Amir shared his analysis of the Singapore case study. First, who are these migrant workers in Singapore? Non-residents, classified as not citizens and also not permanent residents, make up 29% of Singapore's inhabitants, roughly 1.7 million people. About 41% of this group are low-paid migrant workers in the services, manufacturing, processing, construction, and shipbuilding sectors under the category of work permit holders. Work permit holders have an average starting salary of about 18 Singapore dollars per hour, which is the equivalent of 13 US dollars an hour. At the same time, Singapore has a very expensive real estate market that has gone up in price in recent decades, making desirable housing accommodations out of reach for many migrant workers, even though the economy depends on these workers. Most of these migrant workers reside in affordable purpose-built dormitories, or PBDs, built and provided by their employers, as mandated by Singapore government policy. These PBDs tend to be quite crowded and are situated within just 8 neighborhoods in the country. This arrangement made fertile ground for viral spread. Migrant workers ended up constituting the majority of people infected by COVID-19 in Singapore, particularly the migrant workers living in these dormitories. Once the government was alerted to this trend, they did take important steps to address it, including giving paid leave and daily COVID testing to all the migrant workers residing in these dorms, and providing food, internet, and medical support to these workers who were quarantined. Because of the spread among this particular demographic, Singapore had one of the highest COVID infection rates in Asia in April 2020, with rates quickly dropping by June of 2020. This is an interesting case because Singapore had learned a lot from the SARS outbreak in 2003 and had since created a national center for infection diseases. When COVID hit, officials were able to quickly impose quarantine protocols, COVID testing, and widespread contact tracing, and had already put in place measures for airport biosurveillance and hospital intensive care units. These measures were so rapid and so effective that no healthcare workers died from coronavirus, and even infections among healthcare workers were limited. Author Zulfikar Amir asks, quote, "Why did Singapore fail to prevent this big cluster of transmissions from happening among this particular demographic?" Dr. Amir finds that despite Singapore's economy being dependent on cheap migrant labor, these workers were often not acknowledged as being truly a part of the society. And it wasn't just the oversight in the potential for transmission, but the overcrowded living conditions themselves that, quote, have also been partly caused by a collective reluctance among many Singaporeans to accept migrant workers as part of their society. Thus, a gap emerges between the ideas of Singapore as a cohesive society and migrant workers as transient bodies. Amir continues, "The underlying issue is the striking presence of inequality between the local people of Singapore and migrant workers. Their presence is not only socially and culturally ignored by local Singaporeans, their labor is financially underappreciated, and they're in a weak bargaining position." We can see through the Singapore case study that the institutional oversight was not rooted in a lack of scientific or organizational competence to recognize and address the threat of the virus. Instead, quote, "it was primarily prompted by institutional bias and the interests of Singapore's government to protect its own citizens first and foremost," unquote. In cases like this one, Where work is directly connected to housing, like it is for migrant workers, we need to understand workers' experiences holistically in the context of the society they are living and working in.